Good morning, Giselle Prado reporting live from the great Alamo city of San Antonio. Today on It's Our City, Let's Talk, we'll be showcasing several community initiatives that are stepping up and stepping forward to promote equity, diversion, and inclusion. So let's talk. First up is Reverend Ann Helmke, San Antonio's faith liaison. We're in front of the city's recently established Migrant Resource Center. And let's talk, what's happening here?
12 weeks ago, we started to receive an influx of asylum seekers into San Antonio, and our city really stepped up.
How's that?
18,000 folks have moved their way through the city in those 12 weeks. They start here at the bus station down the street and are welcomed by an interfaith coalition, and then come on through to the day center here. It used to be a Quiznos, where they are welcomed and served by over 1,000 community and staff volunteers, 20,000 hours of service, 200 to 450 people a day. We have med clinic visits, 1,300 to date. That's provided by our health community. The food bank, 3 meals a day, over 39,000 meals in this time period. We also have other organizations doing legal aid, hygiene kits, donations, whatever it takes. And then they walked around the corner and down the street to a church where they spend the night.
We're all aware that migration is a hot button these days. Why is San Antonio doing this?
Well, we just can't help ourselves. We're one of the 450 international compassionate cities, officially, and working together. And we work out of that ethic of reciprocity. Not only do we believe in it, but we work out of it to treat others the way we wish to be treated ourselves, and likewise, not to treat others the way we wish not to be treated. Most of us call that the golden rule.
Amazing. Thanks, Ann. Our next guest is Carlos Valenzuela, who is one of SA Speak Up's meeting happening this summer, where residents of San Antonio can learn more about the budget and tell the city what their budget priorities are. I understand that SA Speak Up efforts recently were expanded to now include all city input opportunities.
Yes, so we're actually just wrapping up a city survey meeting where we actually had input of over 8,000 people participated in our SA Speak Up survey to tell us more about the SA Speak Up survey and also the budget, to tell us more about what they want to see. They want to see more infrastructure, more sidewalks. We also expanded our services to also include on a website, which is now in English and Spanish as part of the city's equity strategy. And now people can give us input on anything they want on the city, ranging from senior centers to the city's budget to more sidewalks, more streets, or any other input they want to give us.
Excellent. Under the new SA Speak Up, what are the various stages for residents to give their opinion?
The strategy is very inclusive. It has actually 4 stages. Stage 1 is community engagement. We go to that community in a grassroots strategy where we talk to them and share with them what the city wants to do. Stage 2, they give us their input and their feedback, and then we take that to our city leaders. Stage 3, we create a report based on that input, and then stage 4 is when that policy gets implemented.
Excellent. Thank you, Carlos. I'm here with Zan Gibbs, Chief Equity Officer with the City of San Antonio's Office of Equity. Zan, what are we looking at here?
Giselle, I am so excited right now. What you're looking at is the city's first Equity Train the Trainer program. So this is 40 city employees from various departments all doing a deep dive, 1-week training to learn all about equity, racial justice, economic justice, and various social justice issues so that they can then train their staff in their departments about equity.
And what are the long-term goals of these equity initiatives?
I'm so glad you asked, because the city government has 13,000 city employees. And you know, the Office of Equity is actually only 5 staff. So we recognize that one of our key jobs is to actually make equity everyone else's job. So we're doing this by empowering these trainers to be able to go back into their departments to ensure that all of our services, our programs, and our policies are really aimed at serving our most marginalized communities so that we can eliminate disparities in San Antonio.
Great work, thank you. Up next, a view of the HIV Alliance. I'm here with Hugo Sapian, who's been working with the End Stigma and HIV Alliance, also known as ESHA. Hugo, it's our city, let's talk. Tell us about the Alliance. What have you been doing?
Well, the rate of HIV infections in San Antonio is high. So in October of 2017, an alliance was formed where healthcare and social services providers put their heads together to tackle this problem. What's novel about this initiative is the inclusion of people living with HIV. So the alliance is led by 3 co-chairs, an infectious disease specialist who takes care of the medical aspect, a master's in social work who takes care of the other social determinants of health, and somebody living with HIV who is the voice of the needs of this community. In the time that we've met, close to 1/5 of the attendees are people living with HIV. We've increased the locations where preventive treatment is provided to 18. We have had testing campaigns which resulted in 4,000 additional people tested in 2018. And this is very exciting. We've decreased linkage to care from 34 to 14.8 days. And we're working on an initiative where we provide immediate treatment upon diagnosis. Now, 82% of the people affected are people under the age of 24. So we formed a Health Justice Youth Council to tackle this problem, and Facundo is the one that's leading this initiative.
Great, thank you. Facundo, tell us more about the Health Justice Youth Council.
Thank you so much for asking, Giselle. So Health Justice Youth Council, also known as HJYC, is a group of compassionate youth and adult allies who come together bi-weekly to discuss ways that we can engage the youth in the community. The things that we stress are the importance of knowing your status, HIV education, as well as mental health. If you look behind me, this is a group of wonderful individuals who attended our very first event in October 20th of 2018. It was called our Art and Activism event, where we weaved art, poetry, and music into education on HIV and why knowing your status is important, and we engaged 44 youth individuals at this event.
Very timely and important work. Thank you. So we've heard about the City of San Antonio's initiative to improve equity, the community partnerships coming together supporting the Migrant Resource Center, SA Speak Up's effort to engage residents and promote inclusion, and the HIV Alliance and Health Justice Youth Council's effort to promote a collective impact to the HIV epidemic in Bexar County. Now I have the great pleasure of speaking with Dr. Colleen Bridger, Assistant City Manager and Chief Health Officer. Dr. Bridger, can you share with us how the health department has been promoting trauma-informed care?
Absolutely. The health department has decided to take an upstream approach to preventing chronic diseases by focusing on adverse childhood experiences. We've done that through the creation of a citywide trauma-informed care consortium. This consortium consists of almost 300 people representing over 180 different organizations who have divided into 11 different sectors that work with children. These sectors range from the medical sector to the mental health sector to early education, K through 12. Each sector is working on how they can become trauma-informed. The first thing that we're going to accomplish this year is we're going to establish a trauma-informed care certification entity in San Antonio. This will be the first entity in Texas and will allow every single organization who wants to become trauma-informed the ability to go through the certification process and make sure that when we say we're trauma-informed, everybody understands what that means and we're all meeting that same bar.
There you have it. San Antonio is our city and we're listening, connecting all of our efforts to create real change and foster a community that puts people first and focuses on eliminating disparities for our most marginalized community. Reporting live from the great Alamo City, I'm Giselle Prado with SATV. Thank you.